Dr. Jesse Papenburg is a pediatric infectious disease specialist at the McGill University Health Centre in Montreal. He is a medical microbiologist and a member of the National Advisory Committee on Immunization. Dr. Papenburg, nice to see you again. Thank you for taking the time. Let's start with what we just heard from Quebec and what we just learned about Ontario following suit. That they are not going to mandate vaccinations for healthcare workers. In Quebec, it's 8,000 healthcare workers, I believe, and 5,000 workers that work directly with patients. What do you make of that?
Well, the mandating vaccinations for COVID-19 in healthcare workers, really, there are two main reasons to do that. One is obviously to protect patients who are potentially vulnerable for COVID-19 infection or severe outcomes from that infection. The second one is to maintain the workforce in the context of ongoing circulation of the disease. We don't want to wind up with worker shortages due to infection, and especially also in the context that there can be outbreaks in healthcare settings among workers. Now, it was clear that that by implementing this mandate, they were going to be kind of creating one of the problems that they were trying to address with vaccination, and that was having a problem with maintaining the workforce. So based on their estimates, it just was no longer a good argument for mandating vaccination. So they've replaced that by systematic testing, and hopefully that will mitigate the risk for patients and other healthcare workers that work with unvaccinated persons, and that they won't be transmitting in the workplace.
As a physician, though, are you disappointed by this? Clearly, the health minister is disappointed. They said that they were going to do this, and now they've backtracked. Ontario has followed suit. British Columbia has, in fact, mandated vaccinations. So, are you disappointed?
Well, first of all, the vast majority of Canadian healthcare workers have accepted to be vaccinated, and I think they've done so in part to protect themselves, but also because they feel a responsibility towards their clientele and their fellow workers. So I'd like to highlight that. Mm-hmm. Now, it's unfortunate there is a small proportion that is refractory or for whatever reason do not want to get vaccinated without having a medical exemption. I would have preferred not to have to resort to coercive measures and to be able to convince them, but clearly that hasn't been the case. So I think this is the approach or the compromise that the governments of Quebec and Ontario are now taking.
I'm not a physician, but it's a bit of a head scratcher, is it not for you? I mean, some of these healthcare workers have seen the devastation that COVID-19 can have on patients. They've seen it up close. They've seen people die. They've seen people be very, very sick, be intubated. I mean, I don't get it.
Yeah, and I would answer that by saying that vaccine hesitancy or vaccine resistance comes from a lot of different places or has a lot of different reasons. So clearly, the reasons that you spell out that are quite good in terms of why we would expect that these people would be vaccinated, and the vast majority are indeed vaccinated in terms of Canadian healthcare workers. But the reasons are really myriad for why somebody might decide to not get vaccinated, even though they are working in the healthcare field.
Let's move on to two other quick subjects while we have time, and that is the expansion of eligibility for more and more groups in Ontario and Manitoba, 70-plus Indigenous adults, and then more generally early in the new year. What do you make of that?
Well, I think first of all, what we've seen so far across Canada from excellent studies, BC, Ontario, Quebec, is that 2 doses of COVID-19 vaccine offers excellent protection against hospitalization and with no sign of decline of that protection for 5 to 7 months after vaccination. What we're starting to see a decline in protection is really only in the 80-plus age group. The long-term care facilities actually have already had recommendations for boosters for a while, and that's really due to the fact that the 80 plus and perhaps the 70 plus as well, we're starting to see a little bit of that decline in protection against severe outcomes. Is one, they were amongst the first to get vaccinated, so you have a longer period of time since they received their second dose. And perhaps also these are persons that their immune system might not react as robustly and have as long a duration of immunity as younger, healthier people. So it makes total sense that these are the next groups for which a third dose dose of vaccination would be recommended. And that was already done with the long-term care facility residents, as well as a third dose in the primary series for immunocompromised persons. So a little bit of a difference there, where the immunocompromised people, it was a third dose of the primary series. Here, what we're talking about is a booster dose, 6 to 8 months after the second dose of the primary series, to try and get those antibody levels up. And the evidence shows that that third dose really does give a great boost to those protective antibody levels.
Okay. Finally, you're a pediatrician. So the U.S., the Centers for Disease Control, they've given their final okay to vaccinate children between 5 and 12. Do you think this is going to give a cue to Health Canada? Do you see any reason why Health Canada would not follow suit?
Well, I have to say that looking at the data thus far that's been made publicly available from Pfizer, it's all very reassuring in terms of the fact that the vaccine works in young kids, good antibody levels, good levels of protection in terms of preventing disease. And so far, there have been zero signals of any sort of safety work concerns in that age group. Now, Health Canada still has to do their due diligence and examine the data very carefully. And then afterwards, you'll see recommendations not only from NACI, but from the provincial technical immunization advisory groups, and then implementation if and when we do see approval from Health Canada.
Dr. Papenburg, good to see you. Thank you. That's Dr. Jesse Papenburg in Montreal.